Good morning, everyone. Welcome back to our podcast, Healing is a Journey, Not a Race, with the Healing Center. Today, we are going to be doing episode 4 with our MAT program with our guests, Tracey Lee Jones and Jessica Bennett. So, first, we're going to start off. Can you guys introduce yourselves and your role at the Healing Center and a little bit about your history in the field?
Okay, you want me to start?
Sure.
My name's Tracey Lee Jones. I am a nurse practitioner. I have a few degrees. I have a doctorate in nursing as well. And I've been working in this field for, it's going on a couple decades now. Specifically, substance abuse, it's been about 12 years. So I started off in North Carolina working on a outpatient substance abuse program, and then switched over to detox services. And upon moving out here, it was an easy fit to participate in the MAT program and start to offer outpatient medications for folks suffering with substance abuse disorders.
Nice.
My name is Jessica Bennett. I'm a medical assistant here with the MAT program, and I have my associates in medical assisting for probably like 15 years. But this is my first time working with behavioral health and the MAT program, and I've been here just over a year now, and so I'm learning a lot, and yeah, it's my first time, so I'm still learning, and I'm enjoying it a lot. So
Good. So with the MAT program, can you guys walk us through a first appointment and how you help the patients feel comfortable during that first appointment?
Yeah. So with the first appointment, as far as like coming in for MAT specifically, or just trying to get in?
Both, yeah.
Okay.
Just trying to get in. We can start with getting in.
Yeah, so our folks need to be like established with the clinic to be able to get seen here with any department, and then honestly, when you're first trying to get in even to MAT, it's like a lot of paperwork, it's a lot of paperwork and questions, so you got to be willing and wanting to like go through that process.
Mm-hmm.
Yeah.
So, so I guess that's the key for MAT, and I can go into a little bit more of the bird's eye view of addiction, because to do that, you'll understand MAT better. So just going on just what I've learned over the years, and this isn't in any textbook or anything, but like I look at a person as a set of complex characteristics, and if you were to picture possibly this person as a tree in a forest, and not all trees are going to be the same or have the same life experiences. A lot of people are going to have a lot of chinks in their bark, and some trees are going to be hit by lightning, and some trees are going to fall. So if we look at addiction, we know that this is a person who's suffering with addiction. This person did not choose this life. This life has happened to them for whatever reason, and they're kind of through. So if I'm just drawing a picture here, so like if you're looking at a tree like cross-sectional, so this is just an easy kind of picture. So this is the world out here, right? And this is the person. So, a lot of stuff happens to all of us, like trauma, drugs, and right here would be maybe access to drugs, right?
Mm-hmm.
And maybe their family uses, maybe people are just like overexposed, and so kind of things are happening out here all the time. And whether our bark is resilient and strong enough to like sustain all of these events has a lot to do with where we're from and who we are, right? And also the actual trauma that people are having. So then if we go cross-sectional again, so we're looking at the inside of the tree here, and then we're right here. This would be people using, right? People becoming addicted. Their access to drugs and things like that, it's getting through for whatever reason, and then they're in the process of addiction here, okay? And they're just in it. They're numb, They're having emotional experiences. They're losing things. So loss is a big, big consequence of drugs. And we've all seen this. We've all seen this happen in our families. We've seen it happen in our friends. We've lost people in this area, right? So a lot of people are lost. And they get a lot of negative reinforcement with the rings here. A lot of things keeping them into this addiction process. So until they're really making a decision to change, and that might just be that they've lost everything, their family confronted them, maybe there's some legal repercussions, which frequently happens. So until they really, really decide to change, then they'll enter here. And this is where treatment happens, okay? And treatment does not always mean MAT, but MAT is a part of it frequently. So MAT can offer medications for substance abuse disorders, but also lots of support, education, structure, and accountability. So these are really prime MAT principles. So all of that can happen in here too, and it does. It does happen outside of MAT programs. So people will get into treatment in a lot of ways by social support and counseling. They don't necessarily need any medication. But they are developing healthier life habits during that process, and they're trying to not go back into the addictive process. So that's our job here. MAT is a little piece of recovery, but somebody has to really decide to cross this barrier. They really have to make the decision. They can't be forced, or they won't be successful. If they're forced, if they're court issues and things like that, sometimes we can grab them and get them in and make changes, but typically if they don't decide, they won't stay, they go back out, and then they're back out into this area that's going to be very reinforcing over time. So every time somebody relapses, it's harder and harder to get them to come in. So when we're talking about MAT, we're just talking about a little tiny piece of recovery. Now you're probably wondering what this little circle is here. This is our success, okay? I wish it were bigger, but this is our success. So when we're looking at treatment and all the programs that we have here at the Healing Center, they're all here, and we have a lot of people who are entering successful places in recovery. This is true recovery, and this is the place where people can go where they end up, usually in recovery, giving back to others, providing services themselves. We have a lot of staff here who work here who've been in addiction, so they understand what this process is and how to keep people in treatment. So it's really important to keep our eye on the prize at all times. Even though it's small, maybe sometimes it'll be bigger, but it's still, this is the hope, and this is what we want for everybody, including ourselves. We all want to enter this place of full recovery and giving back to people, so we're always trying to aim for that 100% recovery place, but a lot of people can't quite get there, but they might stay in treatment forever, and that's great too. So there's really no right or wrong.
Yeah.
As long as they're building back their life, and this is a building back area. And that's going to be positively reinforcing anyway. So building your life back, getting your job, getting your car payments, getting your family back, also forgiving yourself and forgiving everyone in your life that led to maybe some of these early life trauma things. That's so big for recovery. And if somebody can never get to that place of acceptance, hopefully they stay in treatment. But eventually, usually people do get there. So there's my little 2 cents of hope. And that's kind of the model I work on, just keeping that in perspective, because MAT is just a little piece of it, but it can be a really super big supportive piece for people.
No, that's a great explanation. Great. So, what do you guys think is one of the biggest misconceptions regarding the MAT program?
I don't know if there's misconceptions, but I do feel like when we do talk to community members, still it sounds like a lot of them don't even know it's available and for what substances that it could be useful for. So that is
it's like getting the word out.
Yeah.
Yeah, I would totally agree. It's just that people don't know. And if they actually knew what it was, accountability, medication, support, education, and providing structure for people, they might be a little bit more open to pursuing it for themselves. But also just letting other family members know that that's there. You know, there's a lot of times people just don't know.
So once someone is in the MAP program, can they ever get off of the medication they are prescribed?
Yeah, absolutely. Absolutely.
And how does that look like? Is it with them for like if they need it for the rest of their life? Do they stay on it the rest of their life?
Sometimes.
Yeah.
So I've had a lot of patients who are decades in on Suboxone and doing great. So for them, being on a low dose of Suboxone isn't, you know, something they're wanting to do. They're wanting to get off of because they feel like they don't want to rock the boat even 2 decades later. So it really depends on a person's just who they are, the amount of support that they have in their house, if they have a supportive workplace, if they feel, you know, like everything is in sync, then they might want to try to come off of it. And we're talking about Suboxone particularly, you know, looking at that, it would just be a very slow taper. It can take 6 months or so typically to get people to come to a place where they're off of it. And during that time, you might have little, you know, cues that it's going so well, they're going to do great. Or, you know, that maybe there are times they want to just pause, you know, during that taper process. So it really just depends on the person and what their needs are and what they want. And it's, you know, it can be a little bit cumbersome to manage, you know, monthly visits or, you know, and all of that. So if they're going to be moving, or a lot of times people choose to come off of it during those times.
Yeah. So. Okay. So is there a success story you guys can share through the MAP program? Do you guys have one?
I've got a few. You know, I know that we've had some here.
We have some successes on board right now.
Right
and,
now.
They're doing great.
How many people do you have in the MAP program right now?
Currently 2.
Right. We have
That's
room
great.
for so
Yes.
much more.
Yes.
2 is better
We've
than
had people in that recovery space.
Yes.
You know, they might not be in the full, like, you know, center area yet, but they're entering it.
Yeah.
So I would say the 2 that we have are entering the inner circle. And then we've had people just very successfully transition their programs to other places in the country and things like that. So
we've had people all over that.
Yeah,
That's good.
And people do go back and forth sometimes between active addiction and treatment, and that's the dance that we do frequently in our facility.
Yeah, it's been interesting, and it does. The numbers they fluctuate a lot. Like I said, I've only been here a year, and I've seen that number be a lot bigger, and I've seen it on every part of what she's saying. So it's interesting. It's neat to see.
Yeah. So what are some new drugs that you see trending nationally, and what do you think has started emerging more locally?
Yeah, so we've been seeing it's coined the gas station drug. So like we actually have seen people come here on some of those agents. Unfortunately, we don't really have the knowledge yet to really successfully treat some of the gas station drug dependencies, but we do know that, like kratom, for instance, is essentially in large doses an opiate, and that those people on kratom need to probably go to an actual formal detox center just to get the specialty services to get off of those things. There's tenazepine, which is like a benzodiazepine type drug that's supposed to have feel-good properties that are sold in many gas stations. So that's another agent that we've been seeing, and I think that's a problem mixed with an opiate. It can be life-threatening. So we are seeing these drugs kind of surface, and people have dependencies to them very easily and very quickly. But we don't, in an outpatient setting, we don't really have a way to treat them fully. In an inpatient setting, when I was doing detox in North Carolina, we absolutely, I did take them in and treat them just because I felt like I could. but there's really no national, protocol or anything to really get people off of these drugs, and you just kind of have to figure it out. So yeah, it's scary out there when you're looking at these.
Yeah. So with these new drugs emerging, how can people protect themselves, or what are some warning signs or information that they should be aware of?
So, looking at signs of dependency, if you've got people in your life struggling, you might be looking for some behavioral changes. You might be looking for sleep patterns changing from their baseline, not just teenagers sleeping in, but maybe teenagers staying up all night. And mostly you're going to see some weight fluctuations, either gain or loss. You're going to see appetite changes, and you're going to see their function in life decrease. So they might not be able to do what they were doing the year before. They might not be able to focus. They might be distracted and extremely irritable. And then you just really got to ask some hard questions to those people and just figure it out together. There are a lot of behavioral changes that people generally will see to give them dilated pupils and things like that. But mostly you just hope they can be honest with you if you're asking direct questions and not going around and trying to do things behind their back. So.
Okay, yeah. So what is something you wish you could tell family or friends of someone who is struggling with addiction? What is some advice you would give them?
I would say, hope. Hope is one of the things that people lose when they're in addiction. There's a sense of hopelessness and helplessness, and that's absolutely just a myth, and it's very false. So there's so much hope, and there's so much, so many tools that we have. So we can help people facilitate hope again in their life, and we worry about the people who are just kind of giving up, because then maybe they've gone through this process and they've kind of been in treatment before, and then they relapsed. A lot of times people will be, just kicking themselves and ashamed and have all of the, problems coming back into treatment. But we know as clinicians and providers that sometimes it takes 10, 25, whatever times to get into treatment for it to stick, and there's always going to be hope at the other side of that.
Great. Yeah, and here there's so much support and resources. I think what we have here it's great for helping people who want help.
Mm-hmm. What is something you wish you could tell an individual who's contemplating seeking treatment?
I would want them just to come in and talk and just information fact find for themselves and see if it's the right fit for them. And there will be some accountability and there will be some processes that we have to go through. So if they're not quite at that place, at least they'll have the information for when they are. Mm-hmm. And I do have a fair amount of people I'm just having a conversation with. And that's all it, excuse me, but that's all it is. It's just an ongoing conversation. I'm just trying to have a relationship and develop a relationship and hopefully trust, so they can come in when they're ready. And that would be the most important thing.
Mm-hmm. Same thing?
Yeah.
Yeah. Mm-hmm. So for the MAP program and all, what is your guys' primary goal for it here at the Healing Center?
I think we're trying to get the word out. I think that's the most important thing. We want people to come in, and we want people to be in this process of treatment, right? And whether that involves MAT or not is up to them, but as long as they're coming in and seeking services or just information, we can offer MAT as a possibility.
Yeah.
Okay, is there anything else you guys want to add about the MAT program?
I could say, let me say one more thing. So MAT typically is the opioid dependency programs, but our MAT kind of does other things too, like with alcohol dependency. We could do a lot of supportive services around stimulant dependency. So, though we're talking about medications for opioid dependency with Suboxone, there are other medications for alcohol dependency. There are other treatments for other issues. So, when we're talking about MAT, I'd like it to be kind of like a broad range, even though a lot of our funding is based on the opioid dependency. So we would, focus on that for those people that need it, but we also have other services and other medications for people in other areas of addiction too. So.
Great. Is there anything else you want to add?
I think so.
Well, thank you guys for joining us today, and thank you guys for tuning into episode 4. We'll see you guys next time.